Okay, welcome to another episode of Clinical Encounters. Today we have our regular guest, Dr Haseeb Royal Khan. All right, so today we'll be discussing a very important aspect regarding the treatment of mental illnesses. It will be based primarily on the psychological treatment that is applicable in mental health. Very often we talk about, when we discuss about mental health, we talk about medicines, like the pills is common and easily available. So that has been a norm. But if we take a closer look, we understand that health itself has been defined by World Health Organization as a complete state of physical, mental, and social well-being, not necessarily only medical well-being or physical well-being. So the definition of health lies, or the psychological well-being is one part of the definition of the health. Hence, obviously, when we're talking about treatment, particularly treatment of mental illnesses, psychological treatment is of mandatory importance. So the point of raising this discussion is that in spite of so much of evidence, we still are not getting adequate, or patients are not getting adequate psychological treatment so far as mental health issues are concerned. So what do you think could be the major reasons why this is the case?
Okay, first of all, thank you so much, Dr. Subhash, for inviting me to this very important session. It is basically to increase the awareness of the general public about this very important modality of treatment that is mostly being overlooked or mostly being missed. I think quite rightly, as you mentioned, from the very basic definition of health, and its biopsychosocial model has been developed. And when we see a patient for the first time or at the review, we take the history. Even just if you look at the sign and symptoms and the basics, the roots of those symptoms, most of them they emerge from either one of those things. It could be like the biological cause, it could be a psychological cause, it could be a social cause. And similarly, after gathering the history, when we move on to the intervention and the investigation, both of them, the investigations as well, they are based on the biopsychosocial model, and the treatment would follow the same model. So now, going back to your question, like why it has not been properly utilized, I think there is a certain amount of misunderstanding or lack of awareness that you can call it, that exists pretty much in the society. Second thing is the availability and the accessibility. There are not too many people, at least when we talk about our region, there are not too many people trained, or what we call them, the experts, available, and those who are available, they are overstretched with the burden of work that have been placed on their plates. So once the awareness is increased, and then again the people our new psychologists, the student psychologists, now a lot of universities they have the program, so hopefully in future these things will catch up. And here, as compared to the West, for example, I can only talk about England and Ireland, where even the GPs, the primary healthcare physicians, they would have access to psychological interventions. They are conducting very important psychotherapies like cognitive behavioral therapy, computer based. So one therapist can at one time can treat many people. So now this is one of the reasons. The second reason is basically, yes, a lot of people or the health services, they may find it a bit frustrating because it is time consuming, and plus it places the responsibility back to the patient, because psychotherapeutic interventions, they are only taken on voluntary basis. It's only if the person is interested, then they have to comply or adhere to a certain timetable. There is a homework that they have to do, and there are a number of appointments, weekly sessions, once or twice, so they have to be. So which means they become totally responsible. And in our region, we still have a little bit of paternalistic approach, where we are left with all the responsibility, and the patients quite often they are reluctant to take charge of their treatment.
Yeah,
So,
thank you. I think it's a very, very valid point. There are a few very important issues you raised. I'll be discussing those in more detail. But before we go further, I forgot one of those preliminaries, the disclaimers. What we are discussing today is the general advice to patients, their relatives, and even medical professionals. If you want any specific advice on any issue, whether to take psychological treatment or not, you must consult a properly qualified
yeah.
medical doctor or who has been trained in psychotherapy. So, having said that, the point you raised is really important, that psychotherapy need not, I know there is a dearth of trained psychotherapists.
Yes.
That's probably one of the major reasons all over the world, not necessarily here.
Yeah.
My experience working in Australia for a prolonged period, I understand they are struggling with that, so much so that they tell trained clinical psychologists are a rare species, endangered species, not available because of obviously the demand. But the point you raised, the issue of using not necessarily psychologists, but general practitioners, other healthcare. Yep. So continuing with our discussion, as you are discussing, it's not necessarily psychotherapy is the only preserve of psychologists. A variety of professionals can deliver psychotherapy with success. There's a lot of evidence. In fact, it is recommended that except very complicated cases where
Absolutely.
a very, very trained specialistic psychotherapy is necessary, psychotherapy should be given by lots of people.
Absolutely.
So when you talk about psychotherapy, in fact, that's another point as well. It's not necessarily we're talking about psychotherapy. Psychological treatment should be differentiated exactly from psychotherapy.
Yeah.
It's because there are many
Types of.
Psychological treatment, not
Absolutely.
necessarily
Yeah.
psychotherapy. For example, somebody doing a professional care to a person using psychological techniques. We should not exactly call it a formal psychotherapy.
Yeah.
Most psychotherapy are manual based, for which we don't have all those, we can't really afford to have the psychotherapist in a huge number, not to train all of them, although that is always expected. I mean, hopefully we should be doing it, but it is not practical. So using available resources is of paramount importance. So
Yes.
what do you think about
No,
that
absolutely,
issue?
because it doesn't have to be a properly trained clinical psychologist, because I have seen many nurses coming from the psychiatric background, they have developed interest and they have gained qualifications, and it also depends on what type of psychotherapy or what type of psychological intervention you're talking about here. A lot of social workers, they would provide, like, in their own domain. So yes, it is quite diverse, and a number of people can be involved in that just to tackle the shortage or to overcome the existing shortage. And one of the other things is basically, Dr. Subhash, which a lot of people they have asked me, so as there are interventions and every interventions would have its own therapeutic effect, but they could have their own side effects as well, adverse effects as well. So I mean, many people that I have referred, they would come back and they said, what would be the possible side effects of this type of intervention? Now, this is, I feel like, this is a bit of a gray area here, because when I looked at the literature search, first of all, there are not too many studies available that have actually, or those were actually designed to monitor and to identify the adverse effects of psychological interventions. So, I mean, I find myself in a difficult situation answering this question,
That's glad that you raised the topic. I mean, I not recently, maybe a couple of years ago, read a paper by Gordon Parker, one of those founding fathers. I mean, he talks a lot about psychotherapy and pharmacotherapy. He mentioned, in fact, the title of the paper was "The Elephant in the Room."
Okay.
7 side effects of psychotherapy. In fact, I remember it correctly. I probably won't be remembering all 7, but few, if I can recall. One is psychotherapy sometimes precipitates an aggressive episode, especially when the trauma is concerned, for example. With a naive psychotherapist, without proper knowledge of handling clinical cases, that might be an issue. So that has to be kept in the mind. Somebody who is offering psychotherapy, it's important to check their background. So that is one aspect. Another as you all know, dependency in a form of interpersonal relationships. I mean, they might foster some form of dependency.
I have read that,
So that is one thing. Another, again, as you very nicely mentioned, psychotherapy may take the focus away from the medical aspect of things. For example, we know that clearly there are medical causes. Psychotherapists or psychologists by their training are not equipped to diagnose those medical conditions. That might be a matter of life and death sometimes. So those are some of the so-called side effects or precautions one has to take. But having said that, there are a lot of therapy we discussed, a lot of discussions, a lot of psychological aspects of treatment that can be done without a special formal therapy. We are by no means diminishing or minimizing the role of the trained clinical psychologists, but at the same time, we have to be grounded, rooted in the reality of the things. So that's the thing. So if I summarize what we discussed today, there are multiple barriers for implementation of psychotherapy. If I may discuss one by one, maybe there are patient factors, there are clinicians factors, there are illness factors, there could be also systemic factors. So patient factor, as we discussed, maybe the type of patient. For example, somebody who is not everybody is suitable for psychotherapy, as you very nicely pointed out. They have to have some sort of motivation, or what they used to call earlier as psychological mindedness. Although some people raise objection that is the pejorative term. Everybody is psychologically minded. It depends upon the therapist. Second is the clinician factor. Some people, by training, by their attitude, they either are pill prescribers or talking type of persons. Ideally, a person should be open for both type of therapy, both type of treatment, and whichever is suitable they should be. Prescribe, but that doesn't happen often. So that is another thing. And also, as they say, psychotherapy is as good as the psychotherapist. So a great personality variable of the therapist also comes to play.
Here I would like to add, because again you have raised a very important point, because I saw an article that was published in October, it's a World Psychiatry Journal, in October 2014, and they did mention, just mostly the adverse effects of psychotherapy, they are not associated with the intervention itself. Actually, they are more related to the therapist.
So therapist factor we cannot ignore. Even in the pharmacotherapy, they tell therapist's aura is very important. But in psychotherapy, that becomes more obvious. The other is we are discussing about the systemic factors, affordability, the number of therapists, for example, is one particular thing. So every health organization, they have to keep this in mind, that psychotherapy is equally important, if not more important, than pharmacotherapy in different phases of the illness. So they have to invest an equal amount or proportionate amount of fund for training as well as recruiting psychotherapists. So patient variables, illness variables, as I mentioned, certain illnesses are more amenable, let's say anxiety-related illnesses, compared to other illnesses. But it's a misnomer that say psychotic illnesses like schizophrenia or bipolar psychotherapy is less important. No. More and more studies are coming. In fact, there is a Cochrane review of cognitive effectiveness, cognitive behavior therapy in schizophrenia. So those are the several factors that has to be kept in the mind. So bottom line from my side, I believe that whenever patients and the relatives are discussing about treatment of psychological problems or psychiatric problems with their doctor, they must or they should discuss about psychotherapy as an issue, and the persons like they can at least raise this issue with a therapist, and that will be going a long way on their whole management of the illness.
Totally agree with you, because again, just if you talk about the comprehensive treatment plan, psychotherapy or psychological interventions, they become a very vital component of any treatment plan that we have in mental health.
So thank you for this introduction today. Hopefully we have raised some issues which you will be thinking, and you would be benefited by this knowledge. So until our next clinical encounter, have a nice day. Thank you.
you.
Bye.